Hi, my name is Jenna. We would like to welcome you to our kidney transplant program. I am one of 4 pre-kidney transplant coordinators. We'd also like to thank you for the confidence that you have shown in our transplant center by seeking out our opinion. You will be watching a series of videos to help educate you about the kidney transplant process at Froedtert and the Medical College of Wisconsin. As a pre-kidney transplant coordinator, our role is to help provide you education about the transplant process. We will advocate for you throughout this process and will work with you to make sure all of your needs are met. The process starts at your first visit. This visit will be approximately 3 to 5 hours. It is our expectation that at least one person attends this appointment with you. This person should be someone that supports you before and after transplant. This person can be a family member or a friend. This visit will be the first introduction to our transplant team members. Your pre-kidney transplant coordinator, transplant surgeon, transplant nephrologist, social worker, financial liaison, dietitian, and pharmacist. This appointment will give you the opportunity for you to learn about us and for us to learn about you. During this meeting, you will have the opportunity to ask questions and become fully informed about the kidney transplant process. You will also be signing several consents, including the kidney transplant evaluation consent, donor consent, and multi-listing consent. After your initial visit, your case will be discussed at the next selection committee meeting to determine the risk versus benefit of transplantation. The selection committee is made up of the transplant team that you will be meeting. You can expect a call after the committee meets and makes a decision if we are able to move forward or if we are unable to offer transplant as an option for you. If the committee has determined that you're able to move forward with evaluation, your coordinator will be in contact with you with your plan of care. This plan of care must be completed and tests reviewed by the selection committee before you will be listed for transplant. The plan of care may include the following: labs, imaging, which may include abdominal CT, chest x-ray, CT of the chest, ultrasound of the kidneys, echocardiogram. Consults may include infectious disease, cardiology, vascular surgery, transplant psychology, pulmonary, urology, or dermatology. Procedures may include cardiac catheterization, stress test, EKG. General health maintenance testing includes mammogram, pap smear, colonoscopy, prostate-specific antigen lab, and dental cleaning. And vaccinations are strongly encouraged to be up to date. Please keep in mind that if new findings are discovered, this could lead to additional testing. You'll be encouraged to complete your plan of care within 120 days, otherwise you may be at risk of being removed from evaluation. If the team feels you are not a candidate at this time, you'll be provided with a plan of care to improve your candidacy. This plan of care must be completed prior to returning to the program.
Hi, my name is Deb Cook. I'm one of the pre-kidney transplant coordinators that works at Froedtert Hospital. I'm going to be reviewing the consents that will need to be signed whenever you meet with the team. The first consent I'm going to review is acknowledging that you received education as far as the evaluation process. It's confirming that you understand that there will be testing involved prior to listing you for transplant, and that testing is determined by the transplant team that you will be meeting with. If you are not a transplant candidate at this time, the team will also be giving you a list of testing or what is needed to improve your candidacy for transplant. There are risks with undergoing transplant surgery, just as there are risks with the alternative to a transplant, which is dialysis. Neither of these options are cures for your kidney failure, only treatments. There are risks and/or side effects from the medications you will need to take for the life of this organ. All of this will be discussed by various team members, so you're well aware of what could happen. By law, transplant centers are required to report the outcomes of transplant surgeries that have been completed at their centers. Every 6 months, this information is updated. You can go to the website srtr.org, which stands for Scientific Registry of Transplant Recipients, and look up any transplant center in the United States to review how many transplants have been completed by various transplant centers and how many are still functioning after 3 years. This website helps you make an educated decision about where you would like to receive your transplant at. Just keep in mind that when a transplant center's numbers start to decline, there are efforts being made to improve that center's outcomes. Transplant services is a highly regulated area of medicine, and we are required to follow all of Medicare guidelines, UNOS guidelines, as well as hospital guidelines. You always have the right to refuse a transplant. You have a right to not follow through with the transplant process once you have heard the risks versus the benefits. You should also be aware that the transplant process has been thought out very carefully, and there is always a plan because of all of these regulations, including if there was a disaster and you did not know where to receive your care, there is a plan in place. There are also changes being based on all of the research that is completed on an ongoing basis. UNOS is the governing body of all transplants. This is the organization that determines who is called for transplants and when. They will contact our center when there is an organ available. Their role in the transplant process is to ensure that a neutral party is choosing the best recipient for the organ available because of the shortage of organs that exists. In 2014, UNOS came up with a scoring system that is still in use today. It is called a KDPI score, a Kidney Donor Profile Index score. It is a score of 0 to 100 and is based on the donor. It includes multiple factors that include age, size, ethnicity, cause of death, health history, and lab values. On the consent, there is an area asking if you agree to an organ that has a score of greater than 85. We encourage every patient to consider this option. Recipients are also given a score. It is called a EPTS score, Estimated Post-Transplant Survival Score. It is another scoring system of 0 to 100. It's based on your age, diabetes status, dialysis, and previous transplant. This score also assists UNOS with the offering process. Individuals with a lower EPTS score would benefit from a lower KDPI score, and those organs would be offered to those individuals first. These are just tools to assist with the distribution process. There are always exceptions to these rules. Another tool that is now in effect is the distance transplant centers receive offers from. The old system had geographical areas divided by population. The new system used by all transplant centers is distance. Transplant centers now have access to organs that are up to 250 miles away. Hepatitis organs are also an option when considering the risk you are willing to accept from the deceased donor. Transplant centers are monitoring the lab values from individuals that are on life support. They know the hepatitis status of the donor. Accepting organs from individuals that have been exposed to hepatitis B in the past and recovered is an option. There is no cure for hepatitis B, so if you were to receive this organ, you may be required to take an additional medication. Regarding hepatitis C organs, you would be agreeing to accept an organ from an individual that currently has a known active hepatitis C virus. Receiving this organ would likely give you hepatitis C, which there is a cure for. No additional medication will be needed to maintain this status. You are always encouraged to be fully vaccinated against hepatitis B through your dialysis center or primary provider. There is no vaccine at this time for hepatitis C. These 3 areas will be reviewed annually. Agreeing to the organs that are considered higher risk may help decrease the long wait time there is for a deceased organ. Currently, the wait time is 5 years depending on blood type. You always have the choice to change your mind about your decision right up until the time of surgery. You will have 1 hour to respond to the phone call when there is an organ available. Our staff will make every attempt to contact you and your emergency contacts. After 1 hour, the organ will not be available. When the donor call staff contacts you, you will be given some information about the organ available, and you will have the option to accept or decline this organ. This call will be coming from a phone number you will not recognize. It is important for you to answer your phone and check your messages. All recipients are encouraged to be listed at more than 1 transplant center. Just keep in mind that wherever the transplant surgery takes place, that is where all the follow-up care will need to be as well.
Working through your evaluation for kidney transplant may take some time. The goal for the transplant evaluation is to make sure that you are safe for transplant. After selection committee, you will receive a phone call and a letter with the testing referrals and lab work that will need to be completed as part of your workup. The transplant assistants will call you to schedule these appointments. Please call at any time if you are unable to make a scheduled appointment. The evaluation will be expected to be completed within 120 days, and if it is not completed, it could affect your eligibility for transplant. When you are ready and qualified, your transplant center will list you active or inactive with UNOS. Active listing means that you have completed all of your required testing and the transplant team is able to receive organ offers for you because you are transplant ready. Inactive listing means that you are unable to receive an organ offer, but you continue to earn time on the transplant list. There are many different reasons to be inactive on the wait list, such as insurance changes, weight gain, medical noncompliance, incomplete testing, if you are medically too well, or loss of your support system. When listed for transplant, it is important to contact your transplant coordinator with updates to ensure that you remain transplant eligible. You will be expected to call your coordinator if you change dialysis centers, you move, your phone number changes when traveling, if you're having surgery, if you are admitted to the hospital, have insurance changes, or if there are any changes to your support team. Keeping in contact with your coordinator will ensure that you're ready at any time to be transplanted. The transplant clinic will call you every 6 months for updates, and you and your support system will also be expected to attend the reevaluation appointment with the entire transplant team yearly. As you get closer to transplant, you may be asked to be seen more often. Many times, additional testing is required for you to remain eligible for transplant, and often your transplant status may be changed from active to inactive. But remember, just because you are inactive doesn't mean you have been removed from the transplant list. Once active on the transplant list, once a month you will need to submit monthly HLA or antibody testing. If you are on dialysis, your dialysis center will draw this and send it back to our center. If you are not yet on dialysis, it will be your responsibility to have your blood drawn at a local lab and send it back to our center. Lab tubes and boxes with directions and prepackaged mailing will be sent to your dialysis center or your home. Always make sure that your first and last name, date of birth, time and date of the draw are on the tubes. This is very important to make sure it is completed monthly when you are active on the transplant list. HLA testing is one way that we can make sure that you and the donor are compatible for transplant. If we do not receive this testing, an organ may be passed up for transplant. Getting called in for transplant can happen at any time of the day. You may receive a call from an unfamiliar number. It is very important for you to make sure your voicemail is set up and that you answer all calls when you're active on the transplant list. The donor call team is given a very short period of time to accept an organ offer, and if they are unable to contact you, they will move on to the next possible candidate. When you are called in for transplant, you'll be provided the time and location of where you should report to in the hospital. Prior to proceeding to the operating room, additional testing will be completed. On average, you'll be in the operating room for approximately 2 to 4 hours, and hospitalization following transplant is approximately 3 days. During that time, you and your support team will receive education on post-transplant care, and you'll meet your post-transplant coordinator preparing to go home. After surgery, you will recover on the transplant floor. Occasionally, there are instances where patients may need an overnight stay in the transplant ICU for closer monitoring. There may be times when you will be called in and then suddenly sent home due to the quality of the organ. Your safety is our #1 priority to ensure a successful transplant. Remember, waiting time varies for all patients. It is dependent on blood types, kidney allocation scores, and your antibody testing results. Following your providers and coordinators' recommendations will ensure that you are prepared and ready for transplant at any time. Following your transplant, there are a few things that you must be prepared for. All of your labs will need to be drawn at Froedtert Hospital's main campus twice a week for the first month. You will also see your transplant team once a week for the first month. After that, you will have your blood drawn every 2 weeks for 2 months and finally monthly for the first year. Your appointment schedule will be reviewed with you by your post-transplant coordinator.
We all want your transplant to be a success. We are here to give you the tools and the guidance to help make that happen.
We encourage you to continue watching the rest of the educational videos that we have provided.
On behalf of the Froedtert and the Medical College of Wisconsin's Kidney and Pancreas Transplant Program, we'd like to thank you for your time and attention, and we look forward to meeting you.